Hello, Assalamu alaikum. It's me, Dr. Muhammad Naseem Shahzad, and today I am going to explain in simplest possible word the concept of this crossed and uncrossed lesion. So I will be discussing three concepts. In this part, I will be discussing four cranial nerves, which is the 12, 5, 7, and 10, means hypoglossal, facial, trigeminal, and vagus nerves. I will be discussing the concept of these four nerves, and if you just try to concentrate, you will understand it and you will be able to collect the question correctly. The second, I will be discussing the crossed hemiplegia, and the third, I will be discussing the uncrossed hemiplegia. To make it very simple, I have given a formula 12 plus 5 and 10 plus 7 is equal to 17. What does it mean? It means if a patient is having a lesion at the hypoglossal or trigeminal nerves, the deviation will be always toward the affected side. For example, if there is a problem on the right side, the deviation will be always toward the right side, toward the side of lesion, right? Toward the side of paralyzed. The second is the 10 plus 7, which is mean the deviation will be always toward the opposite side. For example, in vagus plus facial nerves, if there is a lesion on the right side, the mouth or the deviation will always toward the unaffected side, toward the opposite side. Like there are many examples. When there is a lesion affecting the motor nucleus of trigeminal, on the left, the jaw deviate to the left, right, toward this to the side of the lesion. 12 plus 5 is equal to 17, which means the deviation will always toward be the affected side. So if left, the deviation will be toward the left. But in case of 10 plus 7, the deviation will always be toward the opposite side, right? This is one formula. And there are three MCQs like the fiber which are cross over the pyramidal tract, that's are called pyramids. That's very simple. The second concept is that the auditory information containing both crossed and uncrossed fibers. That's very simple. But the medial lemniscus is primarily contain the crossed pathway. Now I just want to explain these two concepts of crossed and uncrossed hemiplegia. Number first is crossed. Again, to make it simple, crossed hemiplegia always occur at the level of brainstem. So brainstem means midbrain, pons, and medulla oblongata, and that will lead into crossed hemiplegia. What does crossed mean? Crossed mean if a patient is having, for example, if a patient is having pontine lesion, so he will be having facial weakness. This will be like this crossed facial weakness on the right side and hemiplegia on the left side. So this is one sort of crossed right side facial weakness, but on the left side there is a hemiplegia. This is called crossed hemiplegia. So crossed hemiplegia only occur at the level of mid brainstem, which contain medulla oblongata, pons, and that's midbrain. So how to select which one is causing this crossed hemiplegia? That will be depending upon this scenario, and I have given just two examples. For example, if a patient has sensory and hemiparesis on the right side of the body with the involvement of the left side cranial nerves and constructed pupil. So lesion at the site of a medulla. So one thing is clear that it's a cross lesion, and my option will be midbrain, medulla oblongata or pons. So why I have selected medulla? Because of this constructed pupil, because of the location of the cranial nerves. So you can look into other things, but you will not select like the things which is above the brainstem, like internal capsule, like cerebral cortex. So one things will be very clear for you. If there is a cross lesion, one on right side, the other on the left side, we will be selecting among three options: midbrain, pons, and medulla oblongata. Right? For example, if a patient is right hemiplegia with right facial weakness, again pons. The second is the a patient history of stroke present with weakness at the right limb, mandible deviate to the left. Look, now the mandible is deviating to the left, means it's a cross lesion, right? Right and left. Now coming toward the uncrossed lesion. So any lesion which is above the level of the brainstem, that will be leading into uncrossed hemiplegia. For example, If a patient having a lesion in the internal capsule, that would result in right hemiplegia and right facial weakness. So both are right, both are on same side. Okay. So now coming towards some example, a patient is having right-sided hemiplegia plus right-sided facial palsy. Lesion will be at the level of internal capsule. We will be not thinking even of midbrain or pons or medulla oblongata. Right. Now coming toward the other example, a patient with right-sided body weakness and mouth deviate to the left. So many confusing here that it's maybe a cross lesion. It's not a cross lesion. It's actually right-sided body weakness, and there is a right, for example, mouth deviate, so facial weakness, and then when there is a facial weakness, the jaw will deviate to the opposite side. So it means there is a right facial weakness, so right sided body and right sided facial nerves. That's why the mouth is deviating to the opposite side according to this given formula. 10 plus 7 facial nerves. So right facial nerves, the mouth will be deviating to the opposite side. So don't confuse this left sided. This left sided means that it means it's a uncrossed, because the lesion is on the right, the deviation is on the left, which means that that's an injury of the same side, right? So many students confusing it, so make it clear. Now a patient present with paralyzed right arm and leg plus right plantar up going on and exaggerated reflexes left internal capsule again, so sensory loss on left side. And now look into this scenario, there is only sensory loss, like sensory loss on the left side and left side of the body and left side of the face. And we know that thalamus is purely sensory. That's why I have selected here a thalamus, right? So that's very simple. Now coming toward the some type of lesion. For example, the I have given some example. The heminomus heminopia with hemiplegia, the cerebral cortex will be more uh, suitable answer than the internal capsule. Why I have selected cerebral cortex mean that will be giving which type of lesion. The lesion will be uncrossed because it's above the brain stem, but such thing is not given. That's why it seems to be a poor recall, but your understanding should be very clear. Another example is that there is a paralyzed of the left leg, left lower zone of the patient, left semino, all on the same side. Means it's an uncrossed lesion. Means it's above the cerebral cortex. So when it's above the cerebral cortex, means it's a poor brain involvement. Means right-sided cortical lesion occur. Now coming toward there is a patient is having ophthalmoplegia, paralysis or weakness of the eye muscle with hemiplegia. Now why not its pons, why not its medulla? Because we know that the cranial nerves of these weak muscle is located at the level of a midbrain. That's why I have selected the midbrain. Same as the scenario for this one, that a left-sided weakness coupled with right-sided eye deviation suggests again that's the presence of that cranial nerve at that level. And there is another scenario of Weber syndrome is given, Benedict syndrome is given, which is, I have already explained that in circle of Wallace. The thalamus is lesion is a power sensory. This is important. I have given some example also on that. So now you may be confusing that there is a right-sided facial palsy. There is a loss of taste on the right-sided. So right a two-third of deafness and word. So how to select? Because the lesion, the cerebropontine angle, I am selecting it on the basis of the presence of this cranial nerves, the 7th and 8th cranial nerve location. So forget about the crossed and uncrossed. But there is a deafness and vertigo, go for the cerebropontine angle. Another example is also given on this cerebellopontine area. I have also already explained the Brown-Sequard syndrome. This is MCQ, and the bilateral loss. Again, this is MCQ. The cortical tract. This is also MCQ. So better to review. There is no confusion. There's just a revision, right? So best of luck.